Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Bromazepam. Its brand name is Lectopam. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first off, what will we cover in this presentation? We're going to discuss how Bromazepam works. We'll discuss indications or reasons we would prescribe this medication to a patient, then contraindications or reasons we would not be able to prescribe Bromazepam, followed by examples of dosing, and then stick around till the end where we'll talk about side effects. So how does this medication work? Well, it's a benzodiazepine that causes decreased anxiety, muscle relaxation, sedation, and also has anticonvulsant properties. In terms of indications or reasons we would prescribe this medication to a patient, it can be used for short-term symptomatic relief of excessive anxiety in patients with anxiety neurosis. And it should be noted here that it's recommended to use when anxiety is severe, disabling, or otherwise causing extreme distress. Now for contraindications or reasons we would not be able to prescribe Bromazepam, so the first one here would be if a patient had a hypersensitivity to Bromazepam or to other benzodiazepines. It would be contraindicated in patients who have severe liver insufficiency, as well as severe respiratory insufficiency. Patients with sleep apnea syndrome would not be able to use Bromazepam. Patients with narrow-angle glaucoma would also not be able to use it. And it's also contraindicated in myasthenia gravis. Now for dosing with Bromazepam, so in the treatment of anxiety neurosis, the initial dose would typically be 6 to 18 milligrams orally daily in divided doses. They may adjust the dose after 1 week, and the maintenance therapy would typically be between 6 and 30 milligrams orally daily, again given in divided doses. It's also recommended here to use a short course of therapy. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Bromazepam, so I'll go over some of those here now. Some patients may experience ataxia, which is a neurological sign consisting of lack of voluntary coordination of muscle movements, and that can include gait abnormality, speech changes, and abnormalities of eye movements. It may cause dizziness, and it may also cause somnolence. Now, some more rare but serious side effects would be anaphylaxis, the fracture of a bone, or falls, which may also cause fractures, or hostile behavior. That's all we're going to talk about today with Bromazepam or Lectopam. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information to be valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.